Today I'm going to show you how to give a nebulizer treatment. There's two ways to do it. You can give it with a mouthpiece or with a mask. First, I'll show you how to give it with a mouthpiece. This is your nebulizer cup. That's where your medication goes. And then this is your oxygen tubing. One end will go to the bottom of your nebulizer cup, and the other end would go to your flow meter or your oxygen tank. Today, we are using an oxygen tank. In order to give this, take off your mouthpiece, your tubing, your mouthpiece, and your T. This is it with a mouthpiece. If you wanted to take this part off, if you had a mouth breather, or sometimes patients just prefer a mask, you would take your mask and you would just put it on that way. This is a trach collar. Most of you will see this on your floor. You can give a nebulizer through a trach collar with this spring T adapter. It has this cap on. It doesn't matter if the cap is on or off. You'll be able to see that once you insert the neb cup, this opens up. As you take your neb out, it automatically closes out your circuit, so you won't ever have any leaks. That's why we like to use our spring T adapters. So this is what goes around their neck. Get your neb cup and insert it into your spring T. Turn your flow meter back on to about 8, and then you'll start to see that it missed from the mask. This is a BiPAP mask and a BiPAP circuit. These are not typically on our floors. However, in case of a rapid, for wearing at nighttime only, and some people get breathing treatments throughout the night. Same thing as the trach collar, we have a spring T adapter. This will usually be towards the mask or at the machine. You'll just be able to see where it is. Pop off your little cap. Again, it doesn't matter if your cap is open or closed. Your circuit will be closed if there's nothing in your spring T. You'll take your neb cup and you will just push it in. You'll see that that's raised. Turn on your flow meter again to about 8, and it'll be harder to tell on a BiPAP because you'll have airflow coming through your circuit, but you will be able to see that it will mist a little bit. As long as your neb is misting, it's giving the medication. Sometimes if you have a patient that's been here for a while and they've had kind of different medications through their cup, it won't always miss. Just be sure it's always misting, that way the patient is actually getting the medication.